Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the May 15th media availability. Thank you for joining us.
Thank you.
Are some locals with mild or moderate symptoms still being told to stay home rather than get tested? And is it a concern that prioritizing certain test recipients may be giving us an inadequate sample of the Humboldt County population?
Well, I just want to be really clear that we actually have been trying to communicate that everybody with symptoms, with mild symptoms or people without symptoms should be tested. We would like them to come in, particularly and utilize our Optum test site to do that. We do want to mention that people with more significant symptoms should contact their provider first, because we may want to prioritize their testing to be done in county rather than being sent out. But otherwise, we welcome people to the test center. It's an important part of understanding COVID in our community.
Excellent. How many false positives does the county expect its PCR tests are turning up, and how frequently should people get tested?
I don't think we're really getting false positives. Our test is highly sensitive and specific. It can detect just a tiny number of copies of the virus. So it is probably one of the best tests in the country. So I really don't think that that's an issue. What I would tell people is the frequency for testing. Remember that when you're tested, it tells you your status for that day. It really doesn't tell us anything about your status for the next day or the following day. That being said, if you don't have symptoms, we'd recommend that you're not tested any more frequently than about every 2 weeks or so. But if you develop mild symptoms, even if it's been a short period of time, come on in and get tested. If you develop more significant symptoms, contact your provider.
Okay. Is the county only looking at PCR tests to determine if a person is infected with the coronavirus, or does it also look at other factors? And if so, what are those?
Well, what I would say is that we know once a person is exposed to the virus, it can take up to 14 days before they become ill. And we know that some people never become significantly ill. So if we have, for instance, someone who's a contact of a case and they test negative, we may go ahead and retest that person at some point if we really have a concern about the possibility of infection. Because again, we know the test is helpful on the day, but not necessarily in follow-up. I would say that if we do have someone with symptoms who just happens to be a contact, that we test them. If that's a positive result, we know where we are. If it's negative, we still follow them through the quarantine period.
Okay. Some community members have expressed concern over the potential of mandatory vaccinations following the creation of a COVID-19 vaccine. Is there any validity to that concern?
Honestly, I don't see that happening. I think that the bigger issue with the vaccination is when a vaccine becomes available, assuming that it does. I think the bigger issue is going to be that it will be available initially in relatively short supply. So I think it's going to be more difficult to figure out how to prioritize individuals for vaccination rather than forcing people to be vaccinated.
With more cases emerging from Alder Bay, should other facilities prohibit any sort of events moving forward? For example, some of the drive-by birthday parties that have been happening. What is the safest way for them to move forward in this regard?
So I think we've tried to really make it clear to people that when we bring groups of people together, it increases risk of transmission. The closer we bring them together, the more risk there is. And so I really want to emphasize to people that us beginning to move forward does not mean that as a general community, we are now beginning to just mix socially. That is not the recommendation. We are beginning to open up businesses so that we can help our economy and social issues begin to recover, but it is not meant to be an indicator that we can start mingling in groups recreationally, socially at this time. We will get to that place, we're just not quite there yet.
Well, this is the perfect lead into this question. With more places reopening, what about summer camps and other activities for children during the summer when they're out of school? Is there a way for kids to safely resume these kinds of activities?
Well, I think that when we're talking, it really depends on the specifics of what we're talking about. So if we're looking at, overnight, come and reside and camp for a week, those are not going to happen very soon. If we're talking about day camps that may be able to really function as childcare in the same specifications, that may be an option. And so I'm encouraging people who do operate these to look at their operations, and if really what they serve as, and I'm talking about serving local families, not serving people from out of the area, but if their day camp really in the summer can essentially does operate as a childcare option for families, we may be able to work with that. But they should look at the childcare guidances and see if that is something that they can accomplish in their setting. In terms of summer sports leagues and such for children, all I can tell you is right now with it, that's not really on the table. However, it would not surprise me if over the coming couple of months, over the summer, that we're able to see some of those activities start. So, just keep posted.
Okay. At what point will COVID-19 positive patients be transferred to the alternate care site?
So the alternate care site is really meant to be an overflow unit for our hospitals. And most specifically, what we're talking about are people, for instance, who've been hospitalized because they needed hospital care for COVID and now just aren't quite ready to go back to the home setting because they may have some needs like a little bit of oxygen, some other care. So the site is meant to be sort of a pop-off valve for the hospitals to be able to move people off-site if they don't need hospital level care, but still receive some care before they're ready to go home. And so what I would tell you is we're not seeing those kinds of numbers at this time. Our hospitals have capacity to manage their patients, so it is not the time that we would be activating those sites.
Okay. Taking into consideration the first model projection of COVID-19 hospitalizations in Humboldt County, which predicted that a surge of nearly 1,000 hospitalizations would occur in late summer if the mitigation restrictions were lifted on May 1st, do you expect a surge locally that would be similar to what was predicted in that specific model? And how do you expect the actual rise in cases locally to correlate to that prediction?
So what I want to emphasize to people, and it's nice to know people are looking at the models that we put out there, but what I want to emphasize to people is that was not if we did any lifting of restrictions, it was if we completely lifted restrictions, if we had no measures in place to contain spread. That is clearly not the case here. We are starting with small steps to open things up, and we'll be following the data on the ground. At this point, it would be completely foolhardy to just step completely out of our current restrictions. So I do not predict those kind of numbers right now based on what we're doing. That being said, we do have to carefully monitor because we know this virus can spread quickly, and so we want to be watching what's happening.
Okay. We have been told by multiple sources that at least 1 and potentially 3 local casinos plan to open later this month. What would your advice be to tribal governments regarding such proposed openings? And if casinos do open to resume operations, what, if anything, can public health do to mitigate potential risks?
Well, all I can say to that is I think I've really appreciated our partnership with the tribal entities in our county, and I feel like we've been working pretty collaboratively in a lot of areas, and that's been really helpful for Humboldt County. I also have seen plans for reopening, and I think there has, for the plans that I've seen have been very thoughtful about how they might do so safely when it's the moment to do that. But what I can say is that this is not the time. We are far too early in this, and ultimately there's no way to get around the fact that these are mass gatherings. It's an entertainment venue, and people are not only together in large numbers, but they're together for large periods of time, which extends risk. And so what I would say is I'd be disappointed to hear that. I don't think it's the time. I would clearly oppose the opening of casinos right now in our community, although I'm happy to have ongoing discussions about when that moment might be right.
And then last question, how many unlinked chains of COVID-19 transmission has public health identified over the past 14 days?
Well, it's a good question, and again, it speaks to the fact that the report that we submitted to the state. This is one of the indicators that we look at for evaluating where we are on the ground. So what I would tell you is that I can't tell you specifically right now because we have a number of cases under investigation. Through that investigation, we start to piece together who's associated with who in a case line. Sometimes that's obvious, and sometimes it is something we learn 2 or 3 days, and sometimes even longer out as we start to explore the chains of people who are involved. What I would tell you is I would say I think we have at least 3 right now. It's possible that we have a 4th, but that will become clear over the following days. What I do want to emphasize, though, is to remember that this one of the criteria that we had in our epidemiology plan for monitoring was 3 or more unlinked chains of transmission within a 14-day period as being an indicator of something going on in the community that we need to pay attention to. But I want to mention that that is one of the indicators. There are multiple epidemiologic indicators, there are multiple hospital factors and other preparedness factors that go into our equation. So a single factor of concern is not necessarily something that changes what we do, but it's the entire picture.
Great, thank you so much.
Thank you, I appreciate it.